This is Lance Strickler. This is my assessment scenario assignment. My case study that I picked is a 28-year-old patient who was in a single vehicle rollover accident 2 hours ago and has just been brought into your emergency room in a hypotensive state. Injuries included left closed femur fracture, possible head injury, and left hemothorax. The past medical history for this patient is major depressive disorder diagnosed at age 16, generalized anxiety disorder diagnosed also at age 16. She had a tonsillectomy at 18. Medications the patient's taking is bupropion XL 450 every day, paroxetine 20 milligrams every day, famotidine 20 milligrams every day. Looks like they're on lactate ringers, 1 liter now. So when I read this scenario, I just continue to think patient found in this rollover accident, was she the driver or the passenger? Restrained, not restrained. Reasons for this hypotensive state could be dehydration, could be the internal bleeding. We don't know. Possible head injury, but we definitely know the hemothorax, blood and pooling up in the left side of the lungs. I would definitely want to get an assessment. I want O2 sats. I need vital signs. I want to hear the lungs. I want to make sure that this patient's going to get MRI, CT for that head injury, also chest x-ray, and then while they're there, go ahead and get a picture of that leg, that femur fracture. I want to just make sure there is no internal bleeding. Then if she was, I don't know why I'm saying she, if the patient was responsive, I'd want to ask a couple questions, such as that bupropion XL 450 that is at the threshold of that medication's dosing range. Too high of a dose can cause dizziness, lightheadedness. I want to see if that would be pertinent to the reason she had the rollover accident. I'd also want to go get a tox scan or toxicity to see if she was on any medication, drugs, alcohol. But I'd ask her to assess that head injury, if she had a headache, any nausea, vomiting. I would want to check her LOC to make sure she is knows where she's at, who she is, what happened. I definitely want to do a CBC on her. I want to check that H&H. I do believe that if this is a possible internal bleeding, especially in the head injury, if we don't assess this quickly, she could possibly expire. She could stroke. Yeah. On her medication, like I said, I would definitely want to ask her how long she's been taking the bupropion XL. Famotidine, I would ask her if she was able to answer me. I have no past history of acid reflux, GERD, anything like that. I would want to know why she was taking the famotidine. I would also want to go ahead and contact the physicians to make sure we can get PT down there to talk to her. We're going to have to get that leg fixed. And would definitely want to focus on that hypotensive state, get her some fluids. Looks like we have LR already going. Yeah, just want to make sure we have that. If she is having that internal bleeding, we want to get it stopped and make sure she's okay. Once again, I don't know why I'm at stage, but that's it.